Hello students, earlier we had a discussion about how to examine venous disease patient in relevant both varicose vein as well as DVT. Having discussed about how to examine clinical methods and we have discussed about certain investigations also that point of time, and we have discussed about the complications and various parts which is essential while doing clinical examination. Once we have discussed, so what you are going to discuss is next step of that, ahead of that is about the topic varicose veins. Now I already told earlier, I think it is a very morbid disease, even though benign. One second thing is it does not kill, but it really hampers the work, social aspect of the patient's life. It causes pain, distress, discomfort, especially when it is complicated. So third thing is important thing is it is a very common condition. It is not uncommon. So what we are discussing is not a uncommon, very rare, once in a lifetime we see, not such a disease. This is a disease which is very, very common. A day-to-day practice, in surgical practice, you will see such patient, and so all the reason you have to know this topic in detail or at least essential parts. So I will discuss both little bit in depth and also for exam point of view I will discuss. So at the end of this session, students will be able to learn the following: surgical anatomy of the venous system of the lower. This is very important. Earlier I told, I think venous anatomy is very, very complex. They are called as capacitance vessels, whereas arterial system is very simple. It is a one-way track. It's very, very simple. It is a methodical. So this is not methodical. It has got a lot of physics in the venous system. Anatomy is very complex. So that at least essential anatomy in the lower limb. That's what we are always concerned about lower limb diseases, varicose veins. So that system is important, no? And definition, causes, types, features, tests, investigation, management and complications of varicose vein and its surgeries. So all these things you have to know, because theory they will ask so many questions. Exam, it is a clinical examination, always a long case. So once it is a long case, everything in detail will be asked. It is long case for both undergraduate and postgraduates. So, and it is a common disease. So all the reason to know everything about this also. And another thing is, it is very interesting to learn this physics behind it, pathophysiology behind it. So for that you have to know the very clear anatomy. Even though I am mentioning so many names or the means in names while discussing about the anatomy and surgical topics, surgical parts of this topic, it is not necessary to remember every names, but what is stressed is to understand the essential component physics and anatomy of it, which I am clearly explained so that you will have the clear idea. Actually, to tell the truth, I also took long time to understand this science of venous system. So it is rather complex. So surgical anatomy lower limb, superficial veins, outside it is. I will tell what exactly with the diagram. It contains, you got a superficial vein, deep vein. Deep vein is the deep to deep fascia. Superficial vein is outer to the deep fascia. That's exactly meant. Great saphenous vein, long saphenous vein. Now currently it is olden days we used to call it a long saphenous vein. Now current name is great saphenous vein. At your level, if you call both long saphenous vein and great saphenous vein, both are accepted, but terminology has changed currently as great saphenous vein. Short form used is GSV. It begins from the medial part of the dorsal venous arch, medial part in the foot, runs in front of the medial malleolus, ascends upward on the posterior medial aspect of the knee joint towards the saphenous opening. All of you know saphenous opening, long saphenous vein. Another thing I want to say, longest vein in the body, remember, and very important vein also. So many things, because very long saphenous vein or great saphenous vein is used for vascular surgeries, bypass surgery, coronary artery bypass you can use, and also we can use any femoral popliteal block is there, arterial block is there, you can use as a vascular bypass as a graft, actually venous graft in arterial diseases. So saphenous opening lies 3.75 cm below and lateral to the pubic tubercle. It pierces the cribriform fascia to enter the femoral vein. It contains around 12 to 20 valves. So there is